Dr. Brad Taylor. I'm a cataract surgeon for BVA, also do cornea transplants and LASIK. The joy of doing cataract surgery is that it improves patients' quality of life, and usually for the rest of their life. They're extremely happy with how they see, usually even the first day after surgery. So it's extremely rewarding to do this and to have those kind of outcomes. Cataract is the lens of the eye that's gotten cloudy. So what we're doing basically with cataract surgery, simplified, taking out a cloudy lens, replacing it with a clear artificial lens. Surgery is usually either at an outpatient surgery center or outpatient at the hospital. We get you there, they'll start an IV. With that you'll be real relaxed, not so asleep where we have to breathe for you, but you don't care one way or another. And if you do stay awake, usually forget the whole thing anyhow. Surgery takes about 10 minutes, but the total time you'll be at the facility is usually around an hour and a half. To get you ready, similar to today, in that we dilate your eye and it's anesthetized. When we bring you into surgery then, you're covered everything except for that eye with a sterile drape. There's something to keep the eye open. There will be a bright light from the operating microscope. Tiny incision off to the outer side, right where the white and colored part of your eye come together. We go in with an ultrasound probe. That's what breaks up the cataract, vacuums it out of the membrane it's in. The new lens that we replace it with is foldable, so we can keep that incision teeny tiny, and we unfold it right back into the same little membrane we took your cataract out of. We can do that without stitches, there's no patch, you just go home, putting in drops afterwards. Follow-up is 1 day, 1 week. Usually the second eye can be done as soon as the next week, which makes them 2 weeks apart, but it depends how your eye heals, and everybody heals differently. Lens implant that's covered by insurance will give you really good distance vision, or one vision, either distance or near, whichever way you want that set. There are special lenses that can do both, but those aren't covered by insurance. So we can talk more if you decide you want to do something that's out of pocket. Very, very successful surgery though, very little chance of any kind of complication like an infection, retina problem, glaucoma, and most people are right back to normal activity just within a day or two. The implants that we use will last longer than you do, so this is a one-time fix. If there was an issue with the power of an implant, that can be exchanged, but we like to do that early after the surgery, and that's something we very rarely have to do. The majority of cataract surgeries are covered by insurance. If you choose one of the specialty lenses that can correct astigmatism, nearsightedness, farsightedness, and the intermediate distance, then those are an out-of-pocket expense that you can discuss with our schedulers. If you use a CPAP, that can continue to be used after the surgery. There is a shield that you wear at night, but usually you can manage that around the CPAP machine, and that shouldn't cause an issue at all.